Hi, Marcus. Hi, everyone. Today we will be covering sun exposure, sunscreen, and skin health, with specifically focusing on skin cancer and vitamin D metabolism. We have here with us Dr. Magnus Lynch. He's a London-based consultant dermatologist in Harley Street, actually joining us from the operating room. He is recognized for his expertise in minimally invasive skin cancer treatment, facial reconstructive surgery, laser surgery, and regenerative dermatology. Magnus is also one of our advisors sitting on MitraBio's board, and he was the chief investigator of the Mitra clinical trial study on the development of non-invasive skin tests for the diagnostics of melanoma using methylation biomarkers. So welcome to our podcast, Magnus.
Thank you. Great to be here.
Yes, this month, again, we'll be focusing on sun exposure and the impact of skin health. So just to dive right into it, I'd like to start off with covering the effects of UV exposure on the skin directly. So what happens to our skin when we're exposed to UV rays? How does UV exposure influence vitamin D production, risk of skin cancer, and skin aging?
So there's essentially two things which are happening when the skin is exposed to ultraviolet light. So if you think about the skin as layers, you've got the outer layer, which is the epidermis, which is the renewing layer that forms a barrier and is formed from keratinocytes. And these are sort of stem cells which divide and form the outer lining of our skin. And then a little bit deeper down is the tougher fibrous layer, which is called the dermis. And that's largely composed of proteins such as collagen and elastin, and it has a structural role to give strength and elasticity to the skin. Now, ultraviolet light has impacts on both of these structures. So with the dividing cells, the keratinocytes, the ultraviolet light damages the DNA in the cell, and that can lead to spelling mistakes in the DNA, what we call mutations. And those mutations influence the way that the cells grow and divide, and it can cause them to grow too much, and this can lead ultimately to skin cancers. It can also cause pigmentation and skin growths. So that's one effect of the ultraviolet light. But the other effect is on the deeper layer of the skin, the dermis, and it has a couple of things that it does there. So firstly, it will cause the fibroblasts. These are the connective tissue cells that are responsible for maintaining the dermis and keeping it healthy, elastic. They can cause them to die, and the loss of the fibroblasts, these are the sort of worker cells. So if we lose these cells, they don't get replaced. And that leads to breakdown in the integrity of the extracellular matrix. It causes laxity of the skin, causes thinning of the skin. And the ultraviolet light also directly damages the collagen and particularly the elastin proteins, which are the structural proteins within the skin. So multiple effects on different cell types within the skin.
Yes, I understand, and I guess it's good that we're having this conversation one of the hottest days in the UK.
Yeah, what to say of the year today? Yeah.
Yes, indeed. So, well, from UV exposure to the rising melanoma cases. So it's been predicted that by 2040, the global melanoma cases will reach about 500,000 with a 62% increase. What is the link between UV exposure and skin cancer?
So this comes back to the effects of the ultraviolet light on the DNA, which is the sort of the instruction manual for the cell. And ultraviolet light, as I've said, it damages the DNA. It causes spelling mistakes. And according to which cell is affected, this can lead to cancer. So if it's affecting the keratinocytes, which are the barrier cells, then you can get skin cancers such as basal cell carcinoma or squamous cell carcinoma. But we also have another type of cell which lives at the surface layer of the skin, which is called the melanocyte. And that's actually the cells which make the pigment that gives our skin its color and also protects us to some extent from the sunlight. Now, if we have spelling mistakes in these melanocytes, then they can grow too much, and that can form moles. But if they have more dangerous spelling mistakes or mutations, then actually you can get cancers. And these cancers are called melanomas. And this is actually the most serious type of skin cancer because it has the potential that it has quite a high potential that it can spread elsewhere in the body, which is when things become more serious.
Yeah, I agree. With your knowledge, why do you think we're experiencing such a large increase in global cases of skin cancer, specifically melanoma?
Mm. So I think there's a couple of factors. So the particularly in the UK, one of the main factors is that in the 70s and 80s, it became a lot easier to travel abroad to sunny countries. And we know that for melanoma, there's a very clear link between short periods of intensive sunlight exposure, such as going on a holiday, getting burnt, um, or using sunbeds, and the development of melanoma. And that's particularly the case when that sunlight exposure happens as a child or a young adult. So what we're seeing now is really the consequences of those very, those episodes of sunburn, those intense sunny holidays happening probably even 15, 20, 30 years ago, when people probably weren't so aware of the risks and the sunscreens that we had weren't so effective. So I think that's a major factor. I think also just the usage of sunbeds, that's another very, very strong link with the formation of melanomas. So all of these things together have kind of added up into a sort of a perfect storm almost of risk factors for melanoma.
Wow, that's really interesting. How do you think we can effectively check our skin for signs of skin cancer, including melanoma?
So I think the key things to look out for are new lesions, anything which is changing on the skin, and lesions which look what we say atypical, which means that they're irregular. So as a sort of a rule of thumb, we have what's called the A, B, C, D rules for skin cancer, and these are just some guides that can help you identify things on the skin that you might be more worried about. So the first one of these, the A means asymmetry. So that means that when you're looking at, for example, a mole on the skin, rather than it being a perfect circle and the two sides being a mirror image of one another, is actually asymmetrical, and one side looks different from the other. So that's asymmetry. B means border irregularity. So again, rather than having a nice smooth border, you've got an irregular border. C means multiple colors. So if the mole is all one color, it's all nice light brown color, that's a good sign. But if there's lots of different colors, light brown, dark brown, red, blue, white, again, that's more of a worrying feature. And then the final feature is to say that the mole is bigger than 0.5 centimeter, so diameter more than 5 millimeters. Now, these are just rough guide, and they can help you identify things that may need to be checked. But it's important to emphasize that not everything that fits these criteria is going to be a skin cancer. Generally speaking, if you have got lots of moles, it can be very difficult to know which ones to worry about. And I think a good thing to do in that context may be to see a dermatologist, have a full check, and then you know that everything on the skin is fine at that point, and then you can take some photos. And I normally say just repeat the photos every couple of months, get somebody to help you with the back, put the photos side by side, and then you can easily look to see whether things are changing or whether anything new is coming up. That's a good way of monitoring things.
That's a good point. I'm yet to have a full check myself, but coming back to the point on sunscreen that you mentioned earlier, what type of sunscreen should we use during holidays, and is it actually safe to sunbathe while wearing sunscreen?
So I normally tell patients to use a factor of 30 or above, ideally a factor of 50. Almost all of the sunscreens produced by major manufacturers are very effective these days and will give good protection against both ultraviolet A and ultraviolet B. So it's more a case of finding one that is comfortable on your skin so that you'll be comfortable using it every day. And if you are out in the sun, it should be reapplied every 2 hours. And you should, of course, if you're going in the water, you should reapply as well. Now, people focus on sunscreen, but actually, sunscreen is your last line of defense against ultraviolet light. The first thing is sun avoidance, so not going in the sun at all, or if you're in the sun, staying in the shade, trying to avoid the peak hours when the ultraviolet index is the highest, for example, between 10 and 2 p.m. And, wearing long sleeves, wearing a hat, covering up, these are things that you can do, which is going to prevent the UV light from even getting into contact with your skin. And then the last line of defense really is sunscreen. And I think you said, what was the next question? Sorry.
I said we were just interested if is it actually safe to sunbathe with sunscreen on?
So there is no sort of safe level of ultraviolet light, in the sense that whenever your skin is exposed to ultraviolet light, there will be damage to the DNA, there'll be damage to the cells in the skin. Now, if you're wearing sunscreen, then that damage is going to be substantially reduced. So in theory, if you're wearing a factor 50 sunscreen and you're outside for 50 minutes, then that's the equivalent of 1 minute without sunscreen. That's the theoretical definition. Now, of course, when they're testing sunscreen, they're actually using a lot more than we would use normally. So, for example, they would to cover the face, they would use about an egg cupful, which is way more than most people would actually use. So the protection that we get, although it may say factor 50 on the sunscreen sort of packet, in fact, you might be only getting 10 or factor 10 or factor 15. So the answer is there's no completely safe level. It's like anything in life. It's a balance between risks and benefits. It's about reducing your risk. If you enjoy going in the sun, then obviously it's ridiculous to say, well, just don't ever go in the sun, don't go outside. But equally, be mindful that it is a cumulative risk. Definitely avoid getting sunburnt, and having really intense sun exposure, because that's really a strong link with melanoma. So that would be something to avoid at all costs, really.
Yeah, so next time I'm going cycling, I'm definitely gonna be more careful with the sunscreen.
Good, good.
Yeah, so I've been reading some articles in the past, essentially with the effects of flavonoids on skin, and the next question is actually quite an interesting one, being related to diet and risk of skin cancer. So from what you've been exposed to so far, is there any evidence that diet plays a role in skin cancer? And can certain diets, like plant-based one, make us more prone to skin cancer or have more internal protection?
I don't think there's any good evidence that diet has a significant effect on skin cancer, really, either positive or negative. So I think the main epidemiological risk factor for skin cancer is, firstly, sunlight exposure, the amount of UV light that you're exposed to, and secondly, your skin type. So if you've got a fairer skin type, you're at much higher risk of skin cancer, and it's much more important to protect yourself. There's no clear link with diet, really.
Okay, that's good to know. So no flavonoid-based pills to increase the SPF protection from within.
Yeah, I think there's no good evidence that works. So I wouldn't encourage people to focus on that, really.
Absolutely. Coming back to essentially testing skin cancer more efficiently. So we've been working together on quite an interesting trial, looking at the non-invasive diagnostics for skin cancer. How do you think such a tool can be utilized in the future?
Well, the challenge we have at the moment really is that looking at the skin, even with a skin microscope or dermatoscope, it's very difficult for us to say for definite whether something is a skin cancer or isn't. And it turns out that actually a lot of the moles that we remove because we're worried about them, so we're removing them surgically, about 9 out of 10 of those moles which we're removing surgically actually turns out not to be a skin cancer. So whilst we are picking up skin cancers, we've got a high sort of sensitivity for skin cancers. We're ending up doing a lot of surgery, which, ideally we would want to avoid, because even though these are relatively minor surgical procedures, they can have complications. They do leave scarring. And we don't have a good test, particularly for melanoma, that we can do without performing a surgical biopsy of the skin. And if we can develop something which can allow us to pick up melanoma, firstly, it might allow us to pick up melanomas at an earlier stage, because we might be able to check more moles, because obviously there's a limit to how many we would want to remove surgically. But secondly, it will allow us to do less surgery, which will firstly save a lot of money. It will mean that patients don't have unnecessary surgery, and it will avoid all the potential complications of surgical procedures. So I think if we can do that, it will be very important, and a big change in the way that we practice.
Yeah, hopefully we can bring that in the clinics.
Sure, yeah, I'm certain.
Thank you, Magnus. Thank you for the time.
No problem.
And stay safe in the sun.
You too. Have a good afternoon. Bye-bye. Yeah.
Bye.